What causes testicle pain? It may be trauma, post-vasectomy condition, it may be testicular torsion, acute idiopathic pain, also epididymitis and inguinal hernia. Scrotum pain, it may be caused by acute epididymitis or epididymorchitis. The pain is intense and pulling, aggravated by movement and touch, weakening when the testicle is raised and suspended. It's a Crohn's symptom. Here you can see the difficult stages of these diseases and kinds of pathology. It may be thoracic torsion, orchitis, epididymitis, testicular masses, hydrocele, spermatocele, varicocele, and actually it may be rupture. Testicular torsion, hydatitis, sudden onset of very intense pain independent of the position of the testicle. And varicocele and other celes are non-intense aching pains aggravated after physical exertion and weakening at rest. Here you can see a spermatocele in big sizes. It's the testis and the epididymis. Normal testicle has such structure, and testicular torsion has such picture, clinical picture. And characterized by loss of cremasteric reflex, horizontal lie, painful and swollen. These testes can be painful and swollen, and immediate urological consultation is important. Epididymitis, increased flow on Doppler ultrasound picture you can see, and the picture of epididymitis. About seals, hydroceles may be different from congenital to funicular, infantile, encysted hydrocele of the cord, vaginal hydrocele, bilocular, and hydrocele of the herniac sac. Now differentiation between such conditions as hydrocele, hematocele, and varicocele. You can see that hydrocele is a collection of serous fluid, and hematocele is a collection of blood in the tunica vaginalis. You should remember about 7 layers of the testis, and varicocele is a dilated veins, pampiniform plexus. And hydrocele may be indicate inflammation of epididymitis, may be congenital and result from incomplete obliteration of processus vaginalis. Hematocele may appear due to rupture of the testicular artery or trauma, and varicocele is common of the left due to 90 points drainage angle. And now something about changes in urine quality, actually staining. Human urine is typically yellow or a little bit brown, but in some conditions urine may be different in color. For example, in red, it's due to hematuria, myoglobulinuria, it's intake of phenolphthalein, large quantities of beets and blackberries in everyday outtake. Urine also can be green. It's due to such conditions as cholecystitis, hepatitis, pyuria, prostatitis, gonorrhea, taken in sorrel, spinach, apples, pistachios in intake. Also, urine can be blue due to phenylketonuria, is congenital disease, and intake of green beer, such drugs as Viagra, triamterene, also intake cheeses. Urine can be roughly orange. According to intake of rifampicin, it's an anti-tuberculotic drug. Also, it may be caused by carrots. Also, urine can be lilac. We are with catheter, urethral one, and taking phenols. Changes in urine quality also may be brick red color with uraturia, milky white due to phosphaturia or pyuria, dirty brown in case of alkaline pH, greenish yellow in it's a high content of pus in the urine. Also brown color, deeply brown can be in case of melanoma or naphthol poisoning. The next one situation you should know about turbidity of the urine. According to the degree of turbidity, urine can be distinguished as transparent, slightly cloudy, cloudy, milky cloudy. Fresh released urine is normally clear. The clarity of urine is disturbed by the presence of a large amount in it, such substances as salts, drop of fat, mucus. Also, it may be leukocytes, erythrocytes, and epithelial cells. Here you can see the gradation of turbidity of the urine. Turbid urine, it may be phosphaturia, pyuria, hyluria, lipiduria, hyperoxalaturia, and hyperuricosuria. The amount of gas in the urine, its state in fistula between the intestines and the urinary tract. It may be also diabetic flora fermenting glucose with the formation of CO2. Here you can see the differentiation of clear, slightly cloudy, and turbid urine, and the urine color chart, from well hydrated to dehydrated and extremely dehydrated, due to brown color. Common causes of cloudy urine, it may be such as you see at the picture. Increased density of the urine, it may be after intake of small amounts of fluid with food and drink. Large loss of fluid with vomiting, diarrhea, and sweat. Its connection with infectious diseases and microbiology. Kidney disease is not accompanied by violation of the nitrogen excreting function. Also, it may be caused by diabetes mellitus, where the high density of the urine is due to the presence of sugar in it. 1% sugar increases the density of urine by 0.004. The next important part is hypostenuria. It's a decreased density. A person with such a case can have polyuria with copious drinking, resorption of large exudates and transudates, with kidney diseases. It may be chronic and acute nephritis, nephrosclerosis, amyloidosis, cystic kidney disease, or pielitis. Also, it may be prolonged fasting. Diabetes and observance of diabetes can be really a dangerous situation. In this picture, you can see histological picture and immunoglobulin deposits. It's a sign of amyloidosis. The next slide shows us that acidic pH can be a problem too. It may be caused by fasting, severe diarrhea, acidosis, ingestion of acidifying substances such as ammonium chloride, severe physical exertion, febrile illness, and diabetes. In this picture, you can see symptoms of acidosis from central to respiratory, heart, gastric, muscular, intestinal damages of organs. Alkaline pH is not well too, because it may be a sign of metabolic alkalosis, renal tubular acidosis, hyperkalemia, for example, with Conn's disease, and prolonged vomiting or gastric lavage. Significant hematuria can be caused too. Resorption of exudates and transudates with an alkaline reaction. Also, it may be such problem as pollution of urine and abundant growth of bacteria. In this picture, you can see causes of alkalosis according to respiratory one and metabolic one.